Let's see the power of social networking integrated into the patient index. But before I start with the demo, I want to mention two of my people who were my source of inspiration for integrating a chat into the patient index. And I'm not sure if I can mention them, but I don't want to imply that I've been endorsed by anybody that I mentioned. They're just my source of inspiration, and I feel like I need to talk about them. The first one is Dr. Thomas William Ferguson. He is the founder of the e-patient movement, and he is a doctor. A doctor founded the e-patient movement. He urged patients to educate themselves and share knowledge with one another, and urged doctors to collaborate with patients rather than command them. There's another inspiration that I got, and it's from ePatient Dave. In his talk, Let's Patient Help, in his TED talk, he said when he learned that he had a rare and terminal cancer, he turned to a group of fellow patients online and found a medical treatment that saved his life. Social networking, social networking helped him. And then he now calls on all patients to talk with one another, know their own health data, and make healthcare better one e-patient at a time. That's the power of social networking. Inspired by these people, I created the chat model. Let's see it in action. For every disease that you have been diagnosed, you're added to a group chat. When you meet people who have the same disease that you have, and you can ask them questions. What's the best treatment? What's the best doctor? Give me your experience. So let's do some example here. Now we are in the global e-patient community chat. Hi, any new treatment for renal cell carcinoma? Another patient in the e-patient community answers his question. Yes. I heard about a trial with high dose interleukin 2. That's the example that I took as inspiration from e-patient Dave Page. Now, he wants to continue talking in private with that person, and then he goes to this option. He sends a friend request to that person to chat in private, to have a personal conversation. Then he gets it in the list of friend requests and accepts it. Now they're connected, and they can have a private conversation. The power of social networking in the e-patient community. So let's see some example chats that I wrote in the other windows. Individual diseases. I was diagnosed with SP2CL. And the other answer, did you take the clarity test? And then, no, thanks for the info. My diagnosis was wrong. Let's see another conversation with patients involving the retinal detachment. You see, I have retinal detachment surgery, but I'm 20/20. And then another answer, check your medical records to see if retinoschisis is written there and you don't know. Oh, yes, I checked my medical record and it says combined retinoschisis with retinal detachment. The doctor should have told me. And then the answer, that's why e-patients read their medical records, nothing about us without us. Retinoschisis almost never requires surgery, especially if it's asymptomatic. That is the power of social networking in e-patient index. The e-patient index, smart data for patients and doctors, differential diagnosis procedure, symptoms ratio, require labs, Warnings provided by other patients like which GPS feature, misdiagnosed percent rate of diseases, success rate of procedures, percent of time a diagnosis has required a certain procedure, percent of time a risk occurred during a procedure, linking a procedure CPT to a diagnosis ICD code, serious data attached to real medicine code, the LOIN, the ICD-10, ICD-9, CPT, and if the providers put it in the medical record, even SNOMED. Your patient index score. Smart data for patients and doctors. If the doctor forgot to mention a common risk, although the patient who had the same procedure will configure in the CPT admin and it will show in your list of risks. Automatic list of common risks, automatic list of postoperative instructions, automatic list of alternatives. Let's see the CPT admin model. In code admin, the CPT admin will show the real name of procedure, the CPT code, the common popular name, the success rate computed by the patient index app, and if the information has been validated by an expert. So here you configure the default risk for a procedure. No more complaining that the doctor didn't mention PBR. It's going to be provided to you by patient index. The alternative and the post-operative instruction, all this is going to appear automatically once you select a procedure. Let's see it in action. So let's see the CPT admin model in action. An e-patient is going to come to the ICT admin. He's going to request the CPT code from his doctor, and he's going to help all the patients by configuring the CPT with the information that he was just given or the information that he just researched in the internet. He puts here the consumer name, then you will configure the default common risk, the default common alternative that you were given, and the best post-operative instructions that you were given. This will help all the patients. So you have configured the information that you just learned for other patients to use. What's the idea of this? When another patient is scheduled for the same surgery, then he doesn't need to worry if the doctor didn't mention a risk, because your input is going to help him by showing your default risk. We're not saying that these are going to be the final. It's just the system giving you recommendations for questions. So you can ask the doctor, is it true that the PBR is a real risk? And you can confirm with the doctor the post-operative instructions. So this is not going to be like the doctor's decision. It's just for you to have an input. If you don't agree with the information that you get, you can go back to the CPT admin and just flag the information as inaccurate, whereas some other e-patient with better privilege can verify the information and make sure it is reliable. This is the CPT admin where you configure the default risk alternatives and post-operative instructions for other e-patients. E-patient index also has the lab admin where you learn how to code for labs, and there's another video that you will see that teach you how to find the codes for your lab. There are three types of code for lab: the internal for the laboratory, the LOIN international code, and the CPT billing code. Here in the lab master, e-patient index are going to provide an important LOIN to CPT mapping. And you see here the real name and all the synonyms and the consumer name. There's also a symptom admin that you configure to help other patients. The idea is to keep e-patient index free of free text, free of information that is not coded. For example, fatigue, weak, and tired, we don't have to create three different symptoms for these three. What we do is you find the ICD code, because you need to know that symptoms are coded in ICD-10 format too. So you find the ICD code of your symptom, and then you get the real name, and then you add the synonym for future patients to find it. The next slide. Can we have our diagnosis real time? This is an invention that is patent pending. EpatientIndex introduces recordpen.com. Your diagnosis in real time. When your diagnosis is not ready, you leave your record pen in the doctor's office. When your diagnosis is ready, the doctor's office will enter your record pen and your ICD codes in www.recordpen.com. The diagnosis is captured by a patient index and attached to your visit, and you can also get a text message indicating that a new disease was added to your medical record. Let's see it in action. The same way that a doctor asks you for your social, your insurance, your phone number, your address, you're going to provide the doctor with your record pin. That's the identifier from your doctor visit. You go to the record. When you go to your visit, let's create it. So when you create your visit, there's a possibility you didn't get any diagnosis. You go home without your diagnosis. What you do is you get your record pin in the office of the doctor, and when your diagnosis is ready, the doctor goes to recordpin.com and puts that record pin together with your ICD codes. So your diagnoses are provided here in the forms of ICD codes, separated by comma. Success, sending your ICD codes, and then they're captured in EpatientIndex, and you get a text message. The same way you get a text message when somebody adds a credit record for you, you get a text message when somebody adds a disease for you in some hospital. So when you go to your visit, you will see your diagnosis real time provided by recordpen. And you see the importance, telling you that this disease is hereditary, so you can alert your family about this disease. If we are serious about patient protection, recordpen is the option. Welcome to recordpen, your records real time. Thank you.